Hello, I'm Dr. Alper Gökçe. I want to talk about recent developments of soft tissue procedures in scoliosis patients. We will go soft to this heart deformity. In these videos, I intend to share basic knowledge and my professional experiences about the disease I treat them. They are not for treatment advice or cure recommendations. Please turn your physician if you already have it. Scoliosis disease occurs mostly in unknown way and results deformity mainly at the spine, but secondarily at whole torso. Even inner organs are affected from it. Spine skeleton has natural curvatures easily observed from the side, but it's straight aligned looking from the front or back. These give the body perfect symmetry between right and left half of the body. Shoulder breast stays at the same level and depth from the front and back. Scoliosis disease gives the spine an S curvature like the first letter of the word itself, but the severest deformity it is seen at rib cage and called rib hump deformity. It reduces the volume of the cage and that may lead respiratory and circulatory problems along with. The deformation of the cage structure grows out of the mostly at puberty and unacceptable cosmetic results occur. Developmental disorder results in insufficient lung capacity, so early diagnosis of the disease makes it easier to treat at a simpler stage without getting complicated. Surgical indication for implanted rigid fusions begin after curves of 40 degrees and further. Despite the curative effect of the surgery, it deprives the mobility of many joints, which may lead further adjacent degenerations. Treatment interventions at growing ages has consequent problem of early growing stop that may break natural curve development pattern. Classic surgery performed with metal screws attached to the vertebra at affected levels and connected to rigid rods to maintain the correction. In mild curves or immature cases, which has not yet completed the skeletal development, brace treatment is an option. However, it brings a significant disadvantage to the socialization of the child, obstacles sports activities by preventing thoracic expansion, difficulties breathing, deteriorates the quality of the sleep at night, creates pressure wounds at contact areas, brings psychological problems with it, etc., etc. It is tough and long time period extend to several months. The amount of brace wearing time reach in some cases to 22 hours daily. Managing spine growing with selected epiphysiodesis are well-known technique, but it works very well in younger ages. This method is therefore appropriate in congenital cases. However, most of the cases are idiopathic adolescent origin, so in older ages, which will not appropriate for this age interval. Flexible stabilization methods fix spine by tensioning it in defined direction, but allow motion in other directions, with keeping the rope loose. These enhance life quality and also osseous growing there. Similarly, the spine is held with screws but connected with each other flexible rope-like structures, not rigid rods. Surgery may be performed anteriorly or posteriorly or the spine or over the back. Since motion-preserving surgical approaches will guide the growth of the child and ensure the child's movements and protect the flexibility spine in the future. However, this treatment cannot be applied in advanced deformity pattern of patients. Patient selection becomes important for successful results. These are patients in early stages of development or have mild deformity. Also, it has advantages like smaller incision, less hospital stay time, less bleeding, and fast recovery to social life. To summarize, children with scoliosis have dynamic fixation option performed in initial phases has advantage in correction of the deformity without waiting to reaching advanced levels or appropriate age intervals indicated for spinal instrumentation. Also, dynamic scoliosis surgery may be considered in children who can't control or cooperate or refuse orthotic treatments are good candidates. Have a nice day.